prevalence in civil life. The prevalence of prostitution and sexual promiscuity in our cities makes gonorrhea endemic among their population. Smaller towns suffer in proportion to the laxity of their morals and their proximity to urban centers, while the countryside is subjected to epidemics of the disease by the return of the prodigal son. In 1901, the, quote, Committee of Seven reported that there were apparently 162,372 patients suffering from venereal disease in New York City, and of these, nearly 90% were gonorrheics. There were 15,969 cases of gonorrhea actually reported, of which 1,941 were in women and 488 in children. Of these children, 265 had purulent ophthalmia, 218 vulvovaginitis, 5 urethritis. Morrow estimates that 60%, Forsheimer that 51% of the adult male population of the United States have had gonorrhea. He adds, 20% of these young men will become infected before they are 21, over 60% before their 25th year, and more than 80% before they pass their 30th year. Among women, gonorrhea, though more severe, is less common than among men. In the statistics given above, the proportion of men to women is 16-1. It is shocking to learn that almost 1/3 of the reported cases of gonorrhea occurred in married women to whom the infection had been conveyed by their husbands. 988 cases of marital infection were reported, and the unreported cases were believed to be 6 times as numerous. Add to this the ghastly array of 488 children with ocular and genital gonorrhea. Truly, the much heralded syphilis insantium pales before gonorrhea insantium. Footnote. It has been shown by a number of observers that among the poorer classes of New York City, a certain proportion, commonly estimated at 10%, of female infants and young children are infected with gonorrhea in an active or latent form, or as germ carriers. The widespread prevalence of this disease constitutes one of the most difficult problems in hospital management. No institution or hospital for children, however efficiently managed, has escaped ward epidemics from time to time. As an example of typical conditions, the scarlet fever service at Willard Parker Hospital for 1913 will be found instructive. 330 out of 791 female patients on admission had sufficient evidence of vaginal infection to demand their segregation, and of these, 21 subsequently developed clinical and bacteriological evidence of the disease and were transferred to the infected wards. It is not to be understood that all of these 321 cases had gonorrheal infection, even in the latent form, but experience goes to show that a large number undoubtedly did. Without prolonged and repeated examinations causing an unjustifiable annoyance to the patients, this point cannot be accurately determined. Bulletin, New York Health Department, March 7th, 1914.